Skin cancer is the most common type of cancer in the UK. There are two main types, melanoma, which is potentially more serious, and non-melanoma skin cancer, which is usually less serious but more common. Fortunately, most skin cancers are curable if they are detected at an early stage. The best way to detect early skin cancer is to check your skin regularly, about once a month. Everybody should do this, although if you have certain characteristics, you may be at higher than average risk and should be especially careful. These include having a large number of moles or freckles, fair skin that burns easily, red or blonde hair, light-coloured eyes, a history of sunburn, or if you or someone in your family has previously been diagnosed with skin cancer. In a well-lit room, check the skin over your whole body from top to toe. Use a mirror to help and, if you can, ask a friend or family member to help with the areas you can't see easily, such as your back, ears and scalp. Start with your head, working your way down neck, chest, back and tummy. Then check your arms, including your underarms and hands. Finally, check your lower back, including your legs, the soles of your feet and between your toes. Check for any moles or patches of skin that appear to be new or changing. It's normal to have a few moles on your skin, but regular checking will help you to get to know your own body better, and you will be able to spot changes more easily. Although some skin cancers develop in long-standing moles, it's more common for them to newly develop from normal skin. The changes can be different in melanoma and non-melanoma skin cancer, so let's have a look at what they could be. Changes that may be a sign of melanoma can be remembered using A, B, C, D, E. A stands for asymmetry. This means that the two halves of the mole do not match in shape, texture, or another way. Here is an example of this. Please be aware that these pictures are just examples and not all skin cancers look exactly like this. B stands for border. The outside edges may look blurred, notched or ragged. Here is an example of this. C stands for colour. This means that the mole or patch has uneven colour with more than one shade. This could be brown, black, white or pink. Here is an example of this. D stands for diameter. Melanomas will gradually get bigger. If you think something is getting bigger in size or more raised up from the skin, tell your doctor. Here is an example of a patch that is gradually enlarged. Finally, E stands for expert. If you notice one or more of these changes, see your doctor. Although many harmless things on the skin can have one or more of these features, it's always best to get checked. You won't be wasting anyone's time, and if your doctor suspects melanoma or isn't sure, they can refer you to see a specialist. ABCDE is a good way to catch most melanomas, but you should also be aware of other changes which could be a sign of skin cancer. This includes a bleeding lump or patch on the skin, a sore that never seems to heal up as expected, or a lump or patch of skin that is growing or feels different in some way. Non-melanoma skin cancers in particular can be spotted in this way. It can be difficult to remember exactly what your skin looked like before, so taking photographs of your skin can help if you want to look back and check for changes. If you have a smartphone, there are apps that you can use to photograph your moles and remind you to check your skin. But if you're not sure, don't hesitate to see your doctor. Remember, ABCDE. That's asymmetry, changes in border, colour, diameter, or any other change such as bleeding, could be a sign of skin cancer, so see your doctor if you're concerned. Checking your skin should take around 10 minutes once you're used to doing it. It's a small amount of time, but most early skin cancers are curable, so it could save your life.